urban planning and public policy, and a bachelor's degree in informatics and geography from the University of Washington. He previously worked as a researcher at the Korea Transport Institute and a transportation planner at Nelson Nygaard Consulting Associates on various projects related to bicycle planning and car sharing.
Thank you. Thank you all for coming. That was a wonderful introduction. Now that I learned a lot, I did a lot of stuff. My name is Andy. I'm a postdoctoral research fellow at the School of Population and Public Health. I'm actually a technologist. I come from my background in information science. And then I gradually transitioned to urban planning, and now I'm in public health. So my journey from information science to urban planning and public health was basically driven by my desire to find something that's relevant and that can apply to many people. And that happens to be health. And I think health is ubiquitous. It's all around us. As an OEH student, you may actually agree, health is really, really important to many, many things in our life. That's better. It's like a theater. Okay. So, health is so important, and yet we don't really think about it until we get sick. So how many of you have been to a doctor if you were sick? Just a quick show of hands. Obviously. I see someone who didn't raise their hand. I'm really concerned about them. You ought to be seeing doctors when you're sick, right? Another question. How many of you have seen a doctor if you were not sick? That's great. That's great. Yeah, so obviously these are the rhetorical questions. The reason that I'm asking this question is healthy city is basically about this second question that I asked. We ought to be talking about health even if we're not sick. We ought to be thinking about health even if we're not really sick. Because health is all around us and it's so ubiquitous. It affects our behavior. It's affected by our environment. And the concept of healthy city is trying to think and rethink about how we approach health, focusing on this behavioral aspect and environmental aspect. So my research looks at how technology and urban planning affects our health and well-being, and trying to use these tools, these are my tools, urban planning and technology, as a way to get there, as a way to build healthier and smarter communities. So I'm going to share a story of my research, and I hope I can share some excitement with you on this topic today. I'm going to start with some background in sort of these shifting patterns in our health with new global health crisis. I'm going to introduce some of the tools that I use in my research, which is urban planning and technology. I'm going to tell you about the theoretical framework behind this healthy city research. I'm going to walk you through 3 key research questions relating to behavioral health, environmental health, technology, and health. I'm going to summarize my research and talk about my future direction. So as you all know, we're having this new global health crisis. So chronic disease, like diabetes, cancer, heart disease, are replacing infectious disease like tuberculosis, cholera. And by 2020, chronic disease will account for 75% of all deaths worldwide. You know, it's not surprising that chronic disease is becoming a new global health crisis because it relates to our lifestyle. It's about obesity, it's about lack of physical activity, poor diet, which all have reached epidemic levels. So for too long, we've been focusing on treating the symptoms without realizing that there are a lot of issues and underlying causes that really affect our health. And our healthcare model, which sort of focuses on this, treating this infectious disease, focusing on this acute disease, it was basically a reactive system. You go see a doctor when you're sick. But we need a different approach because of these underlying causes that are affecting our health. And what are those underlying causes? About 40% come from the problems in our healthcare system, problems in our genetics, but the rest of the problems, about 60%, come from problems in our individual behavior, problems in our social and environmental factors. So obviously we need a different thinking, we need a different way of seeing how we look at city, how we look at behavior, how we can affect changes in our lives so that we can address these underlying causes that affect our health. And healthy city is basically an idea to, thank you, I thought I'd speak louder, but I should speak louder. Okay, so the healthy city is basically try to tackle all these problems by addressing the root causes relating to air quality, food, schools, parks, hospitals, streets, you name it. And in my research, I use urban planning and technology as a tool to address some, if not all, of these problems to build healthier and smarter communities. So I'll give you an example of my tool, which is urban planning. So this shows a map of walkability in Metro Vancouver. And some of you may have seen this before. Basically, the walkability is a measure of how dense that neighborhood, how walkable that neighborhood, how close a lot of different amenities are located in that neighborhood. So places like in downtown Vancouver has a very high walkability score, walkability index, meaning that you can basically run your errands without relying on your car. And these neighborhoods look something like this. It's very dense, very walkable, very lively. On the other hand, there are other neighborhoods that are not very walkable. As you can see from these pictures, there aren't many sidewalks. There aren't interesting places to visit. You're relying on cars to get to many places in these neighborhoods. So with this data, with the walkability map, I was able to see how these walkability affects our behavior. And this is part of my postdoctoral work with Larry Frank. So we compare people living in this least walkable neighborhood, the Q1 neighborhood, versus people living in most walkable neighborhood. So compared to these people living in the least walkable neighborhood, people living in the most walkable neighborhood were more than twice likely to walk more than 30 minutes per day. So this close relationship between how we build and design our city and how we react, how we behave, which leads to our behavioral health, is much of this ongoing topic in Healthy City. My second approach is a technological approach. And some of you may have heard about this, is mHealth, mobile health. So this is a app called Carrot Rewards. What it does is you can actually download this Carrot Rewards, and I'm curious to see how many of you are aware of this app. Some of you, okay, all right, that's good. So you can actually download this app. You can link this app with your favorite loyalty points, and you can actually earn points by engaging in healthy behavior, like completing some tasks about answering some of the questions related to healthy behavior, or walking for 10 minutes. You can actually get points. So basically, the idea is to incentivize people to engage in healthy behavior. So right now, there are about 150,000 people actively using in British Columbia, and it was a pilot program 2 years ago, just launched it, and it was funded through the Public Health Agency of Canada. Government of Ontario is putting $1.5 million on it, so there's a lot of interest in terms of how we can improve our health through technology, through these mobile devices, and there's a lot of work in this process. So with that, my research is basically looking at how urban planning and technology affects our health and well-being. And particularly, I'm interested in looking at how these factors, how urban planning and technological approach creates both opportunities and challenges in building healthy and smart communities. When I talk about health, it's not just about health. It relates to a number of other issues related to well-being, economy, sustainability, equity. And I'm not just using urban planning and technology, not because I have a background in these areas, but because this shifting paradigm in our health problems calls for a different approach, calls for an approach that is multisectoral, that is multifaceted, not just relying on hospitals or doctors to fix our problems, but to be more proactive about our health through design, through behavioral change, through communications, through technology. So this is a theoretical framework that drives my research. It's called social ecological model. It originated from the studies of Charles Darwin back in 19th century. It's looking at this multifaceted interaction between individual, interpersonal, community, and the environment. So Charles Darwin, he looked at species and plants, how they interact with the environment, and later it was found that our social environment, social systems, has a lot of similarities with this ecological system, hence the name social ecological model. So this model actually looking at, the focuses on this interaction between human and environment, and vice versa. So basically, this is the approach that I use in my research from a holistic point of view and looking at how health are affected by these factors. And throughout this talk, I'm going to showcase one of my studies that focuses on these behavioral health questions that address some of these individual and interpersonal relationships. I'm going to showcase another study that focuses on this environmental health that tries to address this community and environmental issues. And lastly, I'm going to showcase my study on carrots and sticks, which focuses on this technology and health relationship. So these are my key questions. The first question, how does urban environment influence mobility and health behavior? And this is addressing these behavioral health questions, much about this physical activity, how we can improve people's physical activity through design, through urban infrastructure. And I'm going to showcase one of my dissertation studies, which is the Expo line research. Second, how does does urban environment exacerbate or mitigate environmental health risks? So this question is getting to the point about this environmental health issue, and I'm going to showcase my study on noise, using noise 311 data. And lastly, what are the opportunities and challenges of new technology? And I'm focusing on these technological aspects, and I'm going to showcase my new proposal that was submitted to CIHR called Carrots and Sticks Research. So let's look at the first question. So this question emerged out of my dissertation project, looking at the before and after impact of rail line in Los Angeles. And some of you may know Los Angeles is a quintessential example of car-oriented city. It's really hard to get to anywhere without a car in that city if you've ever been to. But there's a hope. There's a bit of a transformation. So in the next 10 years, there will be 6 new rail lines, one of which includes Expo Line that connects downtown Los Angeles all the way to Santa Monica Beach. So who wouldn't want to go to the beach, right? So that's obviously becomes their first project they want to promote. And this also gives us a unique opportunity to conduct a natural experiment-based type of study looking at before and after impact. So with the help of a team of researchers from USC and UC Irvine, we collected data 6 and 8 months before and after the opening of the new Expo Line in Los Angeles. And this shows the study area. So we chose the 6 rail line stations, and then we assigned a treatment group for those people living very close to transit stations. I'll probably use this pointer, these areas, which was defined by half-mile boundary. And we assigned the control group for people living outside of these boundaries. So what this is trying to get is basically trying to get the exposure, how close you are to transit lines versus how far you live away from transit lines. So trying to contrast the difference between people living in the treatment group area versus people living in the control group area. And we chose this neighborhood for the control group for 2 reasons. One, because of the topography in this area, there are a lot of people living on this area. And also, there's going to be a new rail line. So we were trying to capture some of those, future opportunities for our future research. The data collection was a massive effort done by a team at USC and UC Irvine. We collected the data about travel behavior, their physical activity, and also their locational information using GPS. So for travel survey, we conducted a survey for about 300 people, their driving behavior, their transit behavior, your walking and biking. We also monitored their physical activity using a device called accelerometer. We also give them a GPS so that we can track their locational information. So this is an example of the travel survey that we've done. So basically, this is a very typical travel survey that a lot of transportation agencies use. And you can actually get a sense of how their participants' daily travel behavior was, whether they're driving a car, taking a bus, train, riding a bicycle, or just walking. And you have a general sense of how these individuals would travel all throughout the week from Monday through Sunday. We also collected information about their physical activity, and we track their locational information. So the one on the far right, this is a device called accelerometer. It basically keeps track of your movement, acceleration on X, Y, Z plane. And this is the raw data coming out of this accelerometer, and the x-axis is the time and y-axis is the acceleration. So these busy signals indicate that you are doing a very vigorous activity like walking, running, biking. And these quiet signals indicate that you're on sedentary behavior, meaning that there's very little movement. So we synchronize these accelerometer and physical activity data with the GPS to get their location information and also identify whether this individual was inside or outside, so that we can know how active they are, whether they're inside or outside. And this is my analytical approach. I know it can be sometimes very overwhelming with a lot of equations, so I'm going to walk you through this. Let's try this. So what we're interested in is trying to predict the physical activity after the light rail. So we're trying to predict the physical activity after the light rail as a function of all these variables. One is Y1, which is the physical activity before the light rail. So it basically gives us this baseline condition. The I is a treatment condition, whether the person is living close to the transit station or not. So it's basically giving you this exposure measure to transit. And we interacted with these baseline condition and the exposure to transit to get the combined effect of these two measures. And X is basically covariates, usually like demographics with age, income, and sex, to try to control for these other covariates. So this is the result of a direct comparison before and after. Right here, it's y-axis is driving miles per day, and this is before the light rail came, the difference between the treatment group and the control group. Essentially, there's no difference between the treatment group and control group to begin with, statistically speaking. And after the light rail, you start to see the difference statistically between the treatment and control. For walking trips, y-axis is basically the walking trips per day. And if you compare the treatment group and the control group before the light rail came, there's no statistically significant difference between the two groups. But after the light rail, start to see the difference between the two groups. The general pattern you see here is that for driving, if you're living in this treatment group area, you're more likely to decrease your driving, whereas if you're living in this treatment group area, your walking trips has this increasing patterns after the light rail. So this basically shows the differential impact of the physical activity based on the model that I showed you. So people who maintained higher activity levels before the light rail were in the treatment group, they were more likely to reduce physical activity after the light rail. And people who were maintaining lower levels of physical activity before the light rail, they were more likely to increase their activity levels after the light rail. So what this means is that if you're already a walker and biker, by taking transit, you're going to reduce your physical activity. And that's no-brainer, right? And if you're a driver, by taking transit, you're going to increase your physical activity. In retrospect, it all makes sense, but when we were actually designing the survey, actually doing this study, we didn't really expect this to happen. We thought the new transit rail investment will actually have a positive impact on physical activity across the board. That's actually the result of a lot of studies that's using cross-sectional data, just using one time point. But by using this longitudinal data before and after impact, you are able to unpack these individual differences that affect our behavior. So it led me to stretch my thinking not only just in the urban planning realm, but also think about these other factors that relates to your individual behavior. And as for my next step, I'm looking at expanding my research to look at the combined effect of social marketing and urban planning. So in urban planning and civil engineering, there's the notion saying that if you build it, it will come. It's very passive approach. You just build it and waiting for people to come and use it. But with my research, what I'm arguing is that we need to be more proactive. If you build and market it well, market it really, really well, then people will come and use it. So this notion about just building it and waiting for people to come and use is not going to work because really people have different responses based on their characteristics, their behavior, their habits. So you have to actually encourage them to use certain infrastructure, certain design in the changes in your urban environment so that people can actually make use out of it. So we looked at question number 1, looking at the behavioral health. Now we're moving on to the questions about environmental health. So noise is a big problem in many big cities. At least 1 million life years are lost every year from noise. Noise can cause sleep disturbance. It can increase your stress levels, which may lead to depression, anxiety, mood disorders, and etc. Noise is also the second leading cause of the environmental burden of disease, right next to air pollution. So there's this strong link between noise and health, and Hugh Davis, one of our faculty members here at SCPH, is looking into this at his specialty area. So noise does affect our health. In urban areas, there are a number of noise sources. Traffic noise, construction noise, neighborhood noise, delivery trucks. In rapidly growing cities like Vancouver or Toronto, actually construction activities can cause a lot of noise issues. You see all these high-rise buildings going up, and if you happen to work in downtown, you may hear some of this pounding noise during your work hours. So a lot of cities actually have these bylaws to limit construction activities to certain times. But there's a caveat, there's a bylaw, so developers can actually apply to do construction after hours and just pay a small fee. So in Vancouver, there's an anecdotal evidence suggesting that there has been an increase in this application for after work hour permit, about 30% jump over the past 5 years. For noise, the measurement is also an issue. So for traffic, it's continuous noise. You can directly measure them. You can actually estimate traffic noise based on noise model using traffic data. But with other noise sources like construction, neighbors, it's really hard to measure them. They're intermittent. It's irregular. It's really hard to capture the essence of the noise problems. In some studies, they use surveys. They send out surveys asking people how much disturbed you are with your neighbors and construction. But it doesn't give us a very reliable result, very reliable measurement. So the goal of my research with 311 is to use the 311 call data to detect some of these noise issues in the neighborhood. So what are these 311 data? So this is a typical example, example from the city of Vancouver, their 311 call center. 311 call is basically a non-emergency call. You can report to the city. You don't really call when you have an emergency. You don't really use that. But for any other reasons, for example, like garbage disposal, road maintenance, graffiti removal, noise complaints, you can call up the city and make all these kind of complaints. And people actually voluntarily report these type of the problems in their neighborhood. And noise complaints consistently rank about 7 out of all 311 calls. So I use this 311 data, which has been archived since 2005, to only extract noise complaints and construct a noise database from 2010 to 2016. To capture the construction activities, I relied on major project inventory, which is the database that keeps track of large construction projects in BC. Large projects meaning the projects exceeding $20 million. So the projects like the shopping centers down in Richmond, it's high-rises building. It usually takes for like more than 5 years to build this building, and it's very prone to create a lot of noise in the neighborhood. And I mapped this, the project inventory data in Vancouver, and a lot of the projects are sort of clustered around downtown area. Actually use my mouse, clustered around the downtown area, and then sort of dispersed all throughout the city. So this is a map of spatial-temporal patterns of major projects from 2010 to 2013. So I use the kernel density estimation, which is basically a spatial analytic technique to extrapolate points, nearby points, to create this smooth surface. And then, as you can see, the major projects are sort of concentrated around in downtown. In UBC, you may see some constructions going up in here. The general pattern here is that there's this southeasterly direction. It's sort of spreading out more towards south and east. So this is the spatial temporal patterns of noise complaints from 2010 to 2016. Shows a very similar patterns. It's concentrated around downtown area, and then it sort of spreads around the area more towards southeast direction. If you compare them side by side, you start to see these similar patterns in both time and space between the number of constructions and the number of noise complaints. So with these spatial temporal patterns, I developed a model to capture this spatial temporal structure in the data. And I used the multi-level model, and the level 1 is basically trying to look at, to capture the effect of time on noise complaints. X1 is the number of years. And X2 is the number of constructions that are related to noise complaints. And I use this random effects to try to capture the random process that's going on in space. So by controlling for these time and space, what I was interested in is getting at the relationship between the construction activities, how that relates to noise complaints. So this is the model result. So basically the model suggests that each additional year, the number of noise complaints is likely to increase by 10%. And for each additional major project, the number of noise complaints is likely to increase by 5%. So what this suggests is that the noise has been increasing over time, and there is a strong relationship between construction activities and noise complaints. Now, you may see the 5% is pretty small, but keep in mind that this is just for one additional construction that's going on in that neighborhood. If you multiply by 10, you get 50% increase. And these results are highly statistically significant. So some people may have some questions about the data. Potential issue can arise from over-reporting and under-reporting in the noise of the 311 call data. So some people may be sensitive to noise, some people may be not, but that's actually what I was trying to capture. I was trying to capture the perception about noise, and that's really what I wanted to get. But there could be another issue. One study that looks at the 311 calls in Boston area found that there's a correlation with civic participation rate, meaning that more politically engaged citizens are more likely to report complaints to the city. So I'm currently investigating the possibility of reporting bias due to civic participation. So how I do it? So this shows the voting rate map in Vancouver. I got it from the city of Vancouver. I mapped the voting rates. And as you can see, the downtown area, keep pointing this, I should go back. So downtown area, they have a very low voting rate as opposed to this Sunbury area that has high voting rates. So you see this spatial patterns in the voting rates, and I'm developing an adjustment factor to account for these civic participation rates. As the next step, some of you may have noticed, so 311 is not only pertains to Vancouver, it's ubiquitous. All the major cities have this system. So I'm now collecting data from Toronto, Montreal, New York City, Chicago, San Francisco, all the big cities, to build this multi-city noise sensing system. What is very good about 311 data is that it's basically housed on open data platform. So you can use the programming techniques to constantly scrape those data points. So as the citizens, they're reporting their complaints to the city, and it gets accumulated in the database, and I'm using computer programming techniques to scrap these data in real time, sort of a real time, so that I can grow the database going further. So it's a very dynamic programming, dynamic web platform to use and build this multi-noise city sensing system. So we've looked at the question number 1 about the behavioral health, question number 2 about the environmental health. Now we're moving on to the last question. So I introduced you about this carrot rewards briefly in the introduction on purpose. Now we're getting to the fun part. So basically, carrot rewards basically incentivizes you to engage in healthy behavior through a form of loyalty points, which a lot of Canadians like and love about their loyalty points. And I partner with Carrot Rewards team to develop this proposal for CIHR. And I also partner with TransLink, which is the Regional Transportation Authority, and who are working on this mobility pricing program, which will be considered the next 2 or 3 years. Basically what it does is it's basically sort of a tolling system on the major road, major bridges. And the reason why they're doing this is because there is a declining fuel tax problem. Fuel tax is declining because of higher MPG, higher market penetration, of electric vehicles. So they're losing this tax money out of fuel. So they have to come up with a different pricing mechanism to, basically, keep their revenue level. And they're coming up with this mobility pricing program. So by linking this Carol Rewards program and the TransLink's mobility pricing program, we hope that we can encourage positive behavior, at the same time discouraging too much driving, which is negative behavior in public health. And on top of these programming elements, I'm adding the environmental elements that I showed you in the beginning about the walkability surface. Basically, the idea is to use carrot rewards as a carrot and use mobility pricing as a stick, how that plays out in the environment. So whether this person is living in the very low walkable area versus high walkable area, would these programs have same effect in these different neighborhoods? So the idea is to use this individual aspect and combine with the environmental aspect and how we can build, how we can encourage people to engage in healthy behavior. And like I said, I submitted a proposal to CHR to get seed funding, but we're working together with Carol Rewards team and the mobility pricing team to see how we can expand and apply this new research program. So as a summary, I explained my expo line research, which gets to the question about the behavioral health. I showcased my 311 research, which addresses environmental health problems, and carrots and sticks research proposal that looks at the impact of technology and how that impacts our health. And as a next step, like I said, I'm expanding it to incorporate these social marketing aspects, sort of focusing on these individual differences. And I'm expanding noise 311 research to build this multi-city noise sensing platform. And I'm using these Carol Rewards mobility pricing programs to combine in looking at the effective mobile device, the pricing and urban planning mechanism so that we can encourage people to engage in healthier behavior. To recap, our research focuses on this interaction between urban planning and technology and how these urban planning and technological elements create both opportunities and challenges to build healthier and smarter communities. So I'd like to thank Larry Frank, who is my advisor. I'd like to thank Mark, Lauren, who's been working together with the Carrot Rewards, Jad, Chris, Lyle, Jasper, who's all been working together on this mobility pricing program, how to link together with this mobile device technology, with the mHealth technology, with their pricing mechanism, and how to bring together as a new research program. And with all these excitements and opportunities, I would like to step back a little and reflect on this quote from Herbert Simon, political scientist. He said, "There are no morals about technology at all. Technology expands our ways of thinking about things, expands our ways of doing things. If we're bad people, we use technology for bad purposes. And if you're good people, we use it for good purposes." So my take on technology is that it's not a panacea. But it could be a great tool if our goal is to improve humanity, which I believe comes down to health, well-being, and equity. Thank you.
Thank you very much, Andy. This was a fascinating and very interesting talk. I will now open the room for discussions and questions to Andy.
Karen?
Thanks. That was really interesting. I'm particularly interested in the environmental noise aspect research. So two questions really. The first is, what is the unit of measure of the noise? And then the second question is, the metric that you were collecting were complaint calls to the 311. Is that correct?
Yes.
Okay, so I'm kind of curious, mainly because I live in the most highly walkable neighborhood in Vancouver, which lots of amenities, and the amenities also include social amenities like festivals and things like that. And so in my neighbors, right, who are sometimes dialing into 311 because this wonderful festival happening on Granville Island is keeping them awake at 11 o'clock at night. So how do you tease that apart? Because it's not just construction noise that 311 calls would be capturing.
Okay, so about the unit of analysis, so the reason why we use the multi-level is because all the socioeconomic variables are captured within the dissemination area census unit. So that's the level 2 that we capture. So the level of the unit of analysis for the noise is actual calls that happens in that DA dissemination area. That's kept in and treating that as in the level 2 as part of the random effects. And to answer your question about number 2, this is obviously a new data set that's not really meant to be used for research purposes. But the cities are maintaining this data set very rigorously, and they are tracking their performance level, how many calls that they treated, how many calls that they responded, and they even do performance analysis based on this. So this is a very new area of research, and that's a very good question about there may be some anomalies in the data set, there may be some events, there may be some other aspects in noise, but actually right now the cities, a lot of different cities have different systems in terms of noise. Right now in Vancouver, they all collect complaints about noise. So we don't know whether this is due to construction or some other factors, but actually in New York City, they actually have different categories about noise. So I don't know if you can see this, but so this is the data from New York City. So it's giving you an exact time, date and time, and it records the information about which agency is keeping track of that noise complaint. And then it gives you a very detailed category, whether this noise is due to construction after hours, whether this noise is coming from other stuff. So you can actually dig into these more detailed data using some other cities' noise data. That's why I'm developing this multi-city noise sensing platform, not only focusing on the Vancouver, which has an aggregate data point, but in other cities that provides this more detailed information about noise.
Hi, Andy. Thanks for sharing your work. It's great. I love both technology and I love rewards programs, loyalty. So I actually was delighted to see that carrot rewards as part of your research work. But here's a question about that too. It could be both a challenge and an opportunity in this work in that equity, the considerations of accessibility to technology. I know that it's not uncommon that everybody has access to a smart device, but there is yet still a number of people in our populations, in an urban setting, in a rural setting, doesn't matter, that don't have that technology access. So how could you reach that pocket and then apply research to folks who don't have access to this kind of carrot and sticks thing?
Yeah, that's a very good question about equity. So not really related to your question, but I mean the technology, there's, good side or bad side, even with, people are talking about, autonomous vehicles, how that will impact our health. And there's, people are talking about this autonomous vehicles may actually pick up, just focus in certain neighborhoods for those who have mobile devices, for those who actually can really relate to their technology. So this is actually an ongoing problem with incorporating these technological aspects for city design, but also for public health. And I think as we go forward, those problems with, especially with the mobile devices, the penetration rate is really, really high. So it used to be a problem for those people who we can't really reach out to if they don't have a mobile devices. But right now it's about 80%, 90%. A lot of people have mobile devices. And the price of mobile devices is really cheap now. So why not just invest some monies to provide mobile devices so that people can actually use it? I mean, it's not, it's not a rocket science, but the price, both price of the mobile device is going down significantly, and the penetration, market penetration rate is very high. So we are hoping that this mobile health initiative, mobile health direction is actually making sense. It can be more equitable. So I mean, I acknowledge that as a challenge. But as we go forward, it gives more opportunity to invest and innovate on these areas of health. All right, next question.
I'm just going to...
Hi, I'm just, I guess everybody here is not really concerned. I haven't heard any talk about, I mean, you're going to be following these people with their mobile devices, and does nobody have a problem with being followed? Like, who is this information going to be available to? I don't know, it's kind of interesting, everybody's kind of growing up with all these mobile devices, and they give up so much personal information without realizing it. And it's almost kind of an invasion of privacy to a certain extent. So to be handing this out and giving it to everybody, I mean, so you're taking away rewards for people who may be willing to use transit, but aren't willing to be followed everywhere in their daily lives. So just something to take into consideration.
That's a very, very critical question. So this, the problems with privacy is, it's not just, it's prevalent in the use of technology for anything. With the smart city, with the mobile devices, we are able to keep track of where they are, what they do. And it's like, the big guys watching over us, like Google, they have all this information about us. That's a major problem as we go forward. But there's a hope that, we can all come up with some kind of a digital social contract. So, Yeah, so this is more of a sort of an ethical question as a society. What are we trying to do here? So, yeah, so there are a lot of excitements and opportunities around technology, how to make it so that we can improve our health and well-being. But, if our focus is on, sort of a privacy issue or sort of the ethical issues related with technology, we may not actually use that to our benefit. It's not just the technology that improve humanity, but it's how we use them to achieve our own goals. So as a society, we have to make a decision as we go forward with all these new and shiny technology. We have to make a decision. We have to come up with a social contract that we do with our government, that we do with our companies. We do a social contract when you enter, sort of relationship. And when you're entering this relationship with the technology, with Google and Uber, you're going through this, lengthy disclosure, about, how we can disclose your information and this and that. We have to be very careful about how we make these, the contract with the technology. So as a society, we have to come up with some kind of a consensus about how we deal with these issues. And I think as a researcher, that's much of a concern, but also as an opportunity to look into how we can actually incorporate these, the legal issues, the privacy issues as we go forward. So I don't have a clear answer to that right now, but that's something that we all need to think about as a society. Do we want this to happen? Do we want to have a social contract with technology, with autonomous devices? And that's going to be a huge issue as we go forward.
So Andy, we have a few minutes left, and I'd like to take a question from our remote audience. And this is a question that relates to your noise exposure research axis. So the question goes like this: does the 311 record, quote unquote, super reporters for complaints? So what this person is thinking is a scenario where someone who may be particularly sensitive to insult or noise would initiate a report when others would not. So basically, tendency to people to be oversensitive and then have like higher than average reporting, perhaps picking up hotspots that are actually not hotspots. Do you have any level of information?
Yeah, unfortunately, the data is.
Pick on this?
Yeah, the data is data and what it is. So basically, it's an aggregate information, at least in Vancouver. So in other cities, they have different categories. Like New York City, they have this more detailed information about noise. So you can kind of get at to the questions about whether this is actually relating to construction or relating to your neighbors, relating to actual this psychological, some disputes with your neighbors. And as we go forward with this noise issue with this 311 data, and there's actually a very exciting initiative about making it standardized across different cities called Open 311 platform. So the government are putting together to come up with a standard way of capturing these citizen complaints and citizen reporting. And that way we can sort of, capture more nuisance related with complaints, especially with noise. So that's the hope as we go forward.
So we have time for one last question.
Okay.
Hi, thank you. Just following off of that last one, with the 311 noise complaint data, do you have any data with regards to if the complaints are unique or if it's 50 complaints from one person creating a hotspot? And then also I wanted to know, are there any trends with regards to the noise complaints, either with desensitization over a period of time or increased sensitization due to people getting fed up or something like that, creating hotspots or reducing hotspots? Yeah, I was just wondering how robust the data set is, if you can look into any of those things or anything like that.
Yeah, so I cross-checked the noise complaints with other data sets and see if there's like a trending patterns with other data. But this increasing pattern over time is unique to noise only. With other graffiti activities, they show the different patterns over time. So this is very unique to noise. And to answer your questions about hotspots, so basically I've checked whether there's an anomaly in the data set, whether there's like 100 noise calls compared to like 1 or 2 noise calls, and there are not really anomalies going on in the data set. So the first line of screening, we passed the first line of screening, but there may be other possibilities of creating hotspots due to other aspects about noise. So that's the challenge that I have to address as I go forward with the new sort of a data source, looking into this sort of a crowdsourced space citizen complaint data.
Everyone, please join me in thanking Andy for beautifully opening this term's seminar sessions. And I'm sure that if you have further questions, Andy can stick around, right, for any discussion or comments. Thank you.